Obviously, I'm not from Texas. I grew up in Belgium, Brussels. Spent most of my life there till my 20s. Then I came to the States to perfect my English, because I only took 3 years in high school. And I enjoyed the state quite a bit, so I stick around. Met my wife in undergrad in college. I got married and we decided to stay here in the States. I studied manufacturing engineering in college. Then I moved to Nebraska after being in Utah for undergrad. And I worked as a manufacturing engineer for about 3 years. Then I decided that I wanted to do something in life. I wanted to help people more. So I went back to school. I went to Creighton University in Omaha. I did, still in Nebraska, I did a master's degree in anatomy. Really enjoyed it, so I went to medical school. Still at Creighton University. People, I like what I did as an engineer. I like the science part of it. But I felt it was still business related, and bottom line was to make money, which is not bad, you know. Medicine, I feel we can really impact the life of people as individuals, so you can see the results of your actions and you can make people better. And I enjoyed that. I really enjoyed the biomechanical difficulties and principles in the foot and ankle. It really reminded me of engineering. As well, I like the gait, analysis of gait. Again, back to engineering and how you can impact people's well-being just with the gait. People sometimes have hip pains and knee pains because of their foot and ankles. You can really go to the root of the problem and fix it. Also, people tend to do well after surgery. You can give them their life back. People need their feet to walk on. That's what we do every day, right? And so I can really make an impact in their lives and see the results of my treatment, and people are getting better because of it, and so I enjoy that. Yeah, so I like ankle replacements. It's an evolving technique. It's not as good as knee replacements, but we're getting there. We have new implants, new materials, and you can really help people with osteoarthritis. The gold standard was to fuse their ankle where they lose some mobility at the ankle. And with ankle replacement, they maintain that mobility, and it really impacts their lives for the better. So I enjoy that procedure. I think it's an interesting surgery, and you can really impact the patient with the outcome. I also like flat foot reconstructions, where people have flat foot, obviously, and then you can reconstruct the foot and help them to get the pain away and have a better gait, and so I really enjoy those kind of procedures. I like meeting the people. I like clinic and meeting patients. I like the diagnosis, finding out what they have and how I can help them. Then I like the technical aspect in surgery, where I can just help them with their problems and get them a better quality of life. So I have a family. My wife I met when I was in undergrad. I have 5 kids. The oldest is 11, then I have a 9 years old, 6.5, 5, and then I have 20 months old, so all gamut. So we spend a lot of time with the kids. We like to play soccer, tennis, things like that. And then I still like to do remote control airplanes. And I enjoy fishing as well when we have time.